Are you suffering from leg pain, sciatica, lower back pain, neck pain, pain going down into your arms or legs? Have you been told maybe you need surgery? Or are you wondering if maybe you do? You're going to want to wait until the end of this. Hi, I'm Dr. Charlie Schuster. I'm the founder and CEO of Back to Health Non-Surgical. And one of my proudest accomplishments is coming up with a protocol over the last 30 years that involves regenerative medicine, otherwise known as stem cells, and non-surgical spinal decompression through Disc Centers of America, their protocols in over 245 locations. If you're watching this video, it's because someone who cares about you or knows you has shared what we're doing in our clinic.
I was talking to someone who had been coming here, and he said, you need to go back to Health and have them check you out. I was talking, initially it was lower back pain, and it was really, really severe. Whenever I'd be standing at the sink, doing anything at the sink, washing dishes or washing my hands, I couldn't stand there. I had to lean over the sink because my lower back hurt so bad. And my big problem, was my legs because of this right hip. It needed replaced, and that's why I did stem cell, to try to help with that. And my left leg were a disaster because they were helping to support the right side of my body. And so that's what threw the disc off. That's what caused the back problem. It was, I was a mess. They got the muscles all straightened out, and then we started the decompression, and that helped, with the back. And so, the maintenance is the key thing. I think you can't just say, okay, I feel good, and then just give it up. That you really can't do that. You really have to keep up the maintenance because it's just the way the body is. So that has strengthened me, and I can do so much more. I could stand at the sink and not have pain. When I could walk distances and not have pain. When I could stand for a while and not have pain. So, and then just kind of, it was just kind of, the times were like, oh, I'm not having any pain. You don't really know it until it happens. It just kind of creeps up on you, and then because you wonder, I wonder if this stuff's working, But then it's like, oh, wait a minute, I can do this now, and I couldn't do it before. I can bend over now and pull weeds, and I've not been able to do that for a long time, So it's like, oh, it's working. So then you want to keep it up. It's dramatically improved. I don't know where I would be if I hadn't have talked to my friend and said, get over there. I mean, I don't know what I would have done. I suppose I would have gone to the doctor. Maybe I would have had to have back surgery. I don't know. I try to avoid surgeries if all possible. So, but I don't know where I would be if I hadn't have come here.
Yeah.
I say get in there, get an evaluation, talk to them, because they are going to guide you, and they're going to know, and they're going to tell you what would be the best way to go. Well, I would recommend Back to Health to anyone that's having any kind of back pain, leg pain, shoulder pain, any kind of pain. Well, this is a place to be, because the chances are very, very strong they can help you work it out. If not, if surgery is the way to go, well, then they're going to tell you that. But if there's something that they can do, that they know that they can do, they will do it. And so you don't have to live with pain.
We put a lot of content out in our clinic to help people, but this is something that we offer only to our friends and family of our patients. And it's an opportunity to come in, discuss your MRI, your images. Don't have MRI or images, no problem. We'll order if we need them. We'll offer an evaluation and even a trial on our spinal decompression if you qualify and we think that it could help you. So if this is something that you're interested in, there's a reason it was shared with you. Click the link and schedule an appointment. Be sure to mention this video, because that'll allow you to come in at no expense if that's what's going to help you move the needle and make a call that could change your life, we'd love to see you, and I hope to meet you soon. Thank you.